So I'll invite you to first just place a hand over your heart. Just bringing your hand in contact with some place on your body where you can feel your breath moving. We've just been moving in our physical bodies, stirring the breath, and now we're coming into a place of stillness within the physical body. Yet there is still a sense of moving with our breath, our life force, our prana. So just allowing yourself to feel the movement of your breath. And pranayama is the extension of the breath, our life force energy. In the practices of pranayama, we are working with breath control. And as a form of yoga, pranayama is a form of yoga. And so I'll be introducing you to a particular practice called Dirga Pranayama, which is known also as a complete or a three-part breath. So Dirga Pranayama is teaching us how to breathe with the fullness of our lungs, all three chambers of our lungs, beginning with the lower lungs, then moving up to the thoracic region, and then up into the clavicular uppermost part of our lungs. So this is helping us breathe properly in proper diaphragmatic breathing. So we can relax our mind, we can relax our body, we can bring oxygenation into the blood and detoxifying the mind and body. And so this can be done as if you're maybe lying down. This can be a really good place to be able to feel and move through this breath. It is possible to sit up if that feels more comfortable for you. So just tuning in here to what would feel most supportive in your body. I do recommend lying down if that's comfortable for you. So beginning just by taking a few long and wide breaths here. Slow and deep in through your nose for about 4 to 6 seconds, pausing at the top. And then exhale in any way that feels most releasing for you. Let's do one more just like that. Breathing in through your nose, 4 to 6 second inhale. Pausing at the top. And then exhale any way that feels most releasing, letting all the air out. And then placing your hands onto your low belly in between your navel and your pubic bone. So you can bring your index fingers to touch and your thumbs to touch, kind of creating this downward facing triangle. And then placing, so your hands together, fingers touching in this way, below the navel and above the pubic bone. So just feeling your hands on your belly and inhale through your nose and breathing into your hands. So sending the breath deep into your lungs, feeling your low belly rise and your fingers will separate. And then as you exhale, so imagining like this balloon is deflating, your low belly will fall back and your fingers will come again to touch. So breathing in this way as you inhale, sending that breath all the way down, trying to touch your tailbone with your breath, feeling your fingers moving apart, creating space. And then exhale, belly is falling back, fingers are coming to touch. So continuing to breathe in this way. And so we're focusing on the belly expanding. And you might also even feel how the breath kind of expands into the lower part of your back as well. And slow releasing exhale. Smooth and relaxed. We're never wanting to strain. So encouraging this to be what it needs to be in your own body. So taking maybe one or two more breaths in this way, focusing on expanding your lower belly, your fingertips separate. And as you exhale, emptying out all the air in your lungs. And now gliding your hands up your torso to your lower ribs. So we're expanding now into the middle chest region, our mid-thoracic region, by allowing our rib cage to open up to the sides. So you can place your hands, maybe the thumbs wrapping around the side of your ribs and the rest of your fingers on the front of your ribs, almost like you're knitting in your rib cage like a corset. But we're not straining here, right? So just having that touch be gentle, but yet enough that you can feel the expansion of your lungs. So still breathing into your low belly as we were doing. So as you inhale through your nose, slow, deep breath. And then widening through your ribs, feeling your ribs expanding like an accordion. So a 360-degree breath here. And then exhale, everything softens back, low belly, empties all the way to completion. So again, breathing down deep into your belly and then feeling your mid-chest region and your ribs expanding. And exhale to release. So feeling your breath, continuing to breathe in this way first down into that lowest chamber of your lungs, where we do all of the oxygenation and exchange of oxygen and carbon dioxide. Then we breathe into the middle part of our lungs. We feel our ribs opening up to the front, to the side, even to the back. And as you exhale, just noticing what you notice. Feel what you feel here. And on this next time, seeing if you can slow down the breath even more. Smoothing out the edges of the breath. Just take one more in this way, feeling your hands along your rib cage, the expansion of your ribs, widening as you breathe and fill your lungs. And then as you exhale, letting it all go from your belly, feeling your ribs hugging in. And then we'll glide our hands up towards our chest and placing the fingers just below the clavicles. And you could even wrap your thumbs underneath your armpits so we can really make contact with the fullness of our upper rib cage. So first, breathing into that lowest chamber of your lungs, feeling your belly expand, then into the middle rib cage, and then into your chest, feeling maybe even your fingers separating as your clavicles widen, your chest expands with the breath. And then as you exhale, slowly letting it go. As you take your slow inhale, imagining that your lungs are expanding in 360 degrees here. As you inhale, your sternum is lifting, broadening through your collarbones. Exhale, you're feeling your sternum soften towards the back of your heart, back of your lungs. This is our three-part breath that we're combining from the low belly, middle chest, and upper clavicular range here. Slow releasing exhale. And one more time, just like that, feeling your low belly, the middle chest, the widening of your upper rib cage. And as you exhale, releasing your hands down, back to your low belly. And we'll trace the breath here. So as you inhale, breathing into your lower belly, filling that up, and then tracing up the body with your fingertips, now gliding your hands towards your middle chest as you inhale there, and then all the way up to the clavicles. And exhale, we sweep our fingertips back down below the navel. So following the breath here in your own pace, taking your time to really feel the expansion of each chamber in your lungs. This complete or three-part breath. Dirga Pranayama teaching us how to calm our nervous system. Detoxify our bodies. One more time like this, using your hands to trace your breath. Slow releasing exhale. And as your fingertips come back down to your low navel, just letting then your hands fall and rest down by your sides. And continuing with this three-part breath now, but without the touch and the sensation of our hands. Noticing the expansion that's happening in the lungs and in your body, and also perhaps within your mind as well. Allowing yourself to really simmer and savor each breath as you inhale deep and wide, filling the container of your body. And your exhale is slow and releasing. And take one more full breath, this three-part Dirga Pranayama on your own, even seeing if you can slow it down maybe just a millisecond. And then as you exhale, really exhaling so completely, pushing all the air out of your lungs, pushing it out, pushing it out, pushing it out, emptying out. Hold your breath on the exhale, retaining the exhale. This is called Baya Kumbhaka, retention of the breath on the exhale. Simmer there for just another moment or as long as feels comfortable. And when you're ready, allowing a natural inhale to come in. And as you exhale, we release our Dirga Pranayama, our control of the breath. And just notice what you notice. Feel what you feel.